Okay, good morning, everyone. Thank you for joining WASH Academia. Our topic today is we're dealing with the SDG 6 from the perspective of the lack of parity or the inequality in WASH service delivery especially to the rural areas. As we know, Nigeria is way behind on the SDG 6.1 and 0.2 on WASH services, equitable access to WASH services by 2030. And the rural areas and the urban poor are the most affected in this lack of services that we are dealing with. So today, we are going to we're going to be hearing from Jane Bevan from UNICEF, the head of WASH from UNICEF. Okay, here comes Joaquin now. Dr. Joaquin from USAID and Engineer Benson, our retired WASH professional. They will be joining us to help us through the discussions, and then we will chip in wherever we need to. This is a community, so everyone's voice will be heard. Thank you for coming. And on that note, I am going to cede the mic to Madam Jane from UNICEF.
Good morning, everybody. It's a pleasure to be here again with WASH Academia and speaking to this very select but important group about inequality, which is a real problem in the WASH sector. I have a few slides, Vicky. I hope it's okay if I share my screen.
Yes. Yeah.
Can you see that?
Yes.
Great. Let me just put it on full screen. So what I was going to introduce this morning was just some of the data from the WASH norm. As you know, this is the government's, the Ministry of Waters particularly, data set on WASH in Nigeria, and it has a wealth of information that we can all access and use. Okay, so this is the one that shows the top line results. And I was going to say that all of this data from the WASH norm is freely available to anybody, and the link is there in the top right. But I think if you just search for WASH norm in Google, you will find it easily enough. And I think the coverage, as I said, is quite low for having all of the facilities. But if we look at actual drinking water coverage, it's not too bad at nearly 70%. So that's relatively high. And basic sanitation is also almost 50%, which doesn't sound bad. Except when you think about actually the numbers of people that means, because with 23% of people still open defecating, that is 48 million people. So the numbers we're talking about are huge. And what I next few slides, that breaking down the access, we find that there are huge disparities across the country. I mean, disparities obviously geographic, but also I think in terms of other disparities, and one of the most significant is wealth. So all of our data in the WASH norm has been broken down across 5 wealth divisions that we call quintiles. So you can see that access to water and sanitation is much better. And the first box is much stronger in urban settings than it is in rural, almost 50% better in urban. And that again, looking at the wealth quintiles, it's significantly better in the richer quintile of the population, whereas the poorest and the poor and even the middle income people of Nigeria have relatively little access, under 10%. So quite stark division there. And then again, if we look at sanitation and hygiene, it's a similar picture, that urban is much better than rural. And again, the divisions across the wealth quintiles are really quite poor. And then if you look at lumping water and hygiene together, I think that gives the worst picture of all. So hygiene on the whole seems to be probably the worst relation, the poor relation, as it were, of all of the three parts of WASH. And then I'm on slide 5 now. I hope you can see this.
Yes.
In terms of water, yeah, good.
Yes.
In terms of water supply specifically, this has been broken down in the norm by a geopolitical zone. And you can see that there's not too much variation, although it would seem that the Southwest is better off in general for water supply, and the other zones are more or less equal. But again, I think you can see that urban and peri-urban populations on the whole have better access to water supply than rural populations. And again, the division, whilst not bad at 46% for the poorest, could be a lot better, but the richest, almost everybody has access to water. So I think you can see that also on the left, this is for people living with disabilities, which is another division that's made in the norm. And you can see that the numbers are really quite low, particularly in the rural areas. And then moving on to sanitation. This is slide 6 now. We can see that the division between urban and rural, again, is stark. And then the worst is for people, well, they're calling it itinerant, but I think it means for nomadic people, perhaps. And that open defecation is much surprisingly worse in urban than peri-urban, but highest in rural areas at 31%. So moving in terms of equity to access to sanitation, I think it comes as no surprise that it is the poorest who have the least access to sanitation, particularly as the national strategy is that one builds one's own toilet and or rents one. And you can see that only 19% of people in the poorest quintile have access to basic sanitation. And the open defecation inevitably is the highest in the poorest quintile, significantly highest at 48%. And it's a large portion of the country that is in this bracket. So whilst it's divided percentage-wise, I think you can see that it's actually bigger numbers of people in the poorest quintile. And also, I think this literacy division is quite significant. That, I mean, I think literacy might be related to poverty, because poorer are often the ones that drop out of school earlier. But on the whole, the more educated you are, the more likely you are to have sanitation and not open defecate. And then in terms of gender and disabilities, the gender is showing not so much separation, which is good, I guess, that both men and women have equal lack of access, but also that people living with disabilities, it would seem, have less access as well. I think the running man is the undisabled, and the disabled is the lower picture. And so it's actually saying that people living with disabilities here have slightly more access to sanitation than those who don't. And they also open defecate slightly less. But I think you have to consider that the pool of I don't know the actual numbers of the pool of people that were questioned in the norm, but it's probably relatively low.
Mm-hmm.
And then in schools, of course, I think we saw that the coverage was quite low. It seems to be better in secondary schools, but only just. And across the geopolitical zones, you can see the coverage varies, but it's quite low, except again in the Southwest seems to be relatively high at 25%. But still, this is a huge problem that many schools, the vast majority of schools, do not have access to water. And only 3%, 3.4% actually have what we would call significantly gender segregated toilets. So that means that there are separate blocks for the girls and boys, and that girls have some access to menstrual hygiene products. Very low percentage there. So I've given you just a snapshot of these numbers, and you are obviously free to browse the norm at your own leisure. But I think it gives us an idea and an overview that poverty has a huge implication on WASH services. And I believe there was a World Bank survey called the WASH Poverty Diagnostic, which you could probably also find on Google, which looks at this in more detail and maps it across the country. Although it's a few years out of date, I doubt the picture has changed very much in terms of the overall statistics. So I think it shows that in terms of access to WASH, it's worse to be a poor female in Nigeria because they have the least access, and particularly an illiterate female. So it really shows, and I think these numbers really are quite stark and really bring into relief why UNICEF chooses to focus, why the UN in general has this motto of leaving no one behind and really focusing on the poorest, because these are the people that have the least means to improve their lot and to improve their basic infrastructure. So just my last slide is looking at some of the measures that we have been working on with the Ministry of Water to address some of these issues. And the first one I'd like to talk about is the financing mechanisms. So whilst CLTS is in principle a no subsidy approach, the National Strategy for Sanitation is a no subsidy approach, I think there's a dawning realization that it's not going to work if we want to get to safely managed sanitation. It's really not going to work, particularly for the poorest. And I'm pleased Joachim is here because he knows very well that with USAID support, UNICEF is working in the Northwest, in Sokoto, Kebbi, and Zamfara, to trial something called a sanitation voucher program, where CLTS is used to trigger the communities, but then the very poorest receive a voucher which they can exchange for partial completion of their latrine. It doesn't mean full payment for it, so they still need support to dig the pit and perhaps build the superstructure, but it will cover the cost of a good quality slab. So in parallel with building up toilet businesses that can manufacture and produce these slabs, the people who are triggering in the communities are identifying the most poor and vulnerable that could benefit from these vouchers. So this is a work in progress. We're hoping that it will help to really address some of these inequities, but we will be reporting back in hopefully about a year's time to tell you the success of that program. Another piece that UNICEF has been working on, obviously we have these kind of village saving and loans, the Adache, I'm sure everybody's aware of these, but also we've been working through microfinance institutions in various different states to look at co-funding with the government microfinance institutions to give household loans for sanitation. And this includes giving loans to toilet businesses as well, so that they can build up their businesses and have more stock to respond to the demand. But particularly it's for households who would like to spread the cost of a toilet. And the important aspect is that the interest rate is much lower than an average loan, so it's under 10%. And people can space their repayment back over 6 months or even a year if they want to. So this is working in Bauchi so far, but we're also triggering it in Oyo and in Adamawa. So it's still at the trial stage, but we're really hoping that this will be a model which could be replicated in other states. Likewise, the voucher, if we find it successful, so that we can move forward to really address some of these inequalities in sanitation coverage. I think the key is engaging communities, the second point here, because whilst we have looked at national registers for the poor, they don't seem to include everybody, but when you're doing a CLTS engagement, to really look at identifying the individuals that need more support. So that is an important aspect. And then again, in schools, I think we really need to be looking at these gender segregated blocks so that girls aren't dropping out of school for want of a toilet, particularly as they begin to menstruate. It's a very common time for girls to drop out. And in terms of disabilities, I think looking at wash facilities, the designs already exist that are either on flat ground or have a ramp to enable disabled to access it, and that have things like handles and bars, and particularly a seat for those who cannot squat. So I think we're looking at, as everybody knows, I think LGA-wide approaches to sanitation, so that it's not little isolated centres of excellence, but these dots join up to get a whole LGA open defecation free. And I think all of these measures need to be included in this, particularly in poorer areas, to really make sure that nobody is left behind. And just a final area that I wanted to mention is getting the private sector more involved, and particularly the private sector in public places to develop these PPPs where we have it's a business effectively. People are paying to use the toilet, and we've seen this being very successful in various different states. So in a nutshell, those are just some of the areas that UNICEF's working on, but I'm very happy to answer any more questions if you have them. Thank you very much.
All right. Thank you so much, Jane. What I'm seeing from the data that we just saw is I am looking at the data and thinking we need to get services to as many as 150 million Nigerians by 2030. That's like 3 countries. You know how big we are. That's like 3 countries. And considering the current situation, financial, economic situation in the country and everything else, what are the chances? What are real chances of getting to that 6.1 and 6.2 by 2030?
Are you asking me a direct question, or is this a question
Yes.
for?
I'm asking you
Well,
first.
I think, and I've said this often, that whilst it is an incredibly ambitious goal, Nigeria is so capable. We have so many capable people in this country, and if there were a real political will to achieve these goals, we can achieve them. I've seen how Nigeria tackled polio, for example, how Rotary got involved. They promoted it across everywhere. I was actually speaking to Rotary last week, and I really was urging them to get involved with the similar promotion that they did for polio for WASH, because I think they have huge clout. I think we need to get everybody involved, the religious institutions, the political institutions, and all of walks of public life, the private sector, everybody to get involved. This is what happened in India, and they made it happen. But it was all because of the huge political will and because the leader really wanted it to happen. Now we have the vice president leading the Clean Nigeria campaign, and he has the potential to have similar clout. So I think a lot of it is down to individual states, and we've seen where state governors, for example, have been very committed, such as in Jigawa, that we have really had traction, and things have started to move because there was the political will. And this is what it comes down to. It's allocating sufficient resources for this to happen, and it's really getting people involved. So yes, I mean, it's a huge challenge, but it's possible.
Okay. On that note, don't leave yet. Doctor, okay, so Joaquin now is Sir Dr. Chief Joaquin.
Yeah, good
Okay,
morning.
Joaquin.
Yeah, good morning. Let me start by thanking Jen for the good work they are doing within the WASH space. I know UNICEF is into a lot of things, including nutrition and a lot of other development needs. But I know that WASH is where we all have an ecosystem because we work within that space. So I'm happy to have come at the time I did to listen to her, and I also thank you for organizing this. We in USAID we try our best to push the development agenda, and we work with our partners like UNICEF because we believe that every partner has some strengths that we can tap from, and there are a lot of innovations we see in what a partner like UNICEF is doing within the sanitation space. So here we are interested in some KPIs, so which we track with our indicators. We insist that there must be a monitoring, evaluation, and learning plan for all activities we fund, and we look at the numbers. Because if you look at the global strategy, USAID for WASH, there is, before we used to have disproportional numbers as targets for water and sanitation. But now I think the thing has been, they have equal numbers. When we say we want to meet the water and sanitation needs of 30 million people, that means 30 million people on water and 30 million people on sanitation, and is global. There's targets set for Nigeria. We have our own country plan. So this responds to those gaps we see in WASH norms when the statistics stay us in the face. And it's good that we have this data platform, which we can always use to measure our progress, to know where it starts more like a baseline. So we can plan from there and measure our improvement, because if we don't measure the work we are doing, it becomes difficult. So we'll track our progress. So I will give you a rundown on some of what we'll call them the standard indicators. Then we'll have also the custom indicators. Custom indicators are indicators that were not classified as standard, but which in the course of implementation in the field, you found them important to help you manage the activity in the field. But for us, all standard indicators, we do what we call data quality assurance on them to make sure that they are cleaned and that they give us the information we need. And this is what we use to justify our need for more funding from the US Congress, because those standard indicators have been approved by the US Congress, and they use those indicators to know how we are performing with regards to reducing the numbers. So every partner we engage, we agree on a monitoring and evaluation and learning plan so that we can count the numbers. Unfortunately, when people make proposals to USAID, you see that their commitment to the monitoring and evaluation plan is usually weak. You see that what has been budgeted for maybe to reduce the numbers, and which cannot be empirically verified using a MER plan, usually weak when you have a budget that supports more of administrative things and things that don't really give us the desired results, moving from the output level to the results we need. So it makes it difficult to even push such proposals forward. But we have been happy to have a partner like UNICEF, have partners for development. We have Mercy Corps, we have CRS, and we have a number of Nigerian local NGOs like Green Habitat Initiative. All have been working together with us to achieve some of those goals. Another thing that we insist on to ensure that we deliver on this mandate is the fact that the engineering must be right. I know there are a lot of, the space is occupied by a lot of social scientists, social workers.
Recording in progress.
Very few engineers. So we insist that the engineering must be right. So we have a process of looking at the design and approving it. You can get somebody who will design, but the design must be returned to us to look at it. I was thinking that maybe the federal government can lead in this process by developing a standard design or options, design options that can every participant in this space can queue into. So we have our preferred approach to construction, and that preferred approach is that he that designs will not build. You get an independent engineering firm who will design and then supervise while the contractor builds. So the contractor will be different. So when you design, we approve it, then people bid for it, other parties bid for it. Then when they bid and they will build, your job, since you designed it, is to ensure that they are building what you designed. So we use that to ensure that there is quality assurance. Even in locations that are difficult to access, like the Northeast and some parts of the Northwest, we have our field-based monitors who move around with those designs to make sure that what you are building is what was agreed. So that is it. Then another thing what we are currently managing to ensure that sanitation and water succeeds, that we accomplish the goals, is aspect of asset management. We insist that we need something more sustainable and not management that is led by volunteers. I know that over the years we have what we call water consumer associations or washcoms, who are mostly volunteers. People are looking for better life and people are moving every day from those communities. So don't make that level of investment and leave it in the hand of volunteers who are mostly farmers who are struggling to take care of their other needs and they are not actually being paid. And there is no business case for those investments to support asking them to recover costs from those things and use it to take care of themselves, as well as the facilities. So we have come up with some homemade solutions to ensure that an asset management plan is put in place so that when we build a facility, we'll ensure that it continues to go on. It continues to provide that functionality for which it was put in place. So we'll continue to count the numbers and we're happy to work with as many partners as possible. We have what we call the new partner initiative. Is for Nigerians and is for Nigerian organizations. It's for locally established organizations. What I mean by locally established organizations, the organization might have been registered ab initio in the US or in South Africa or in India, but you can do the work and you have an office in Nigeria. You have up to more than 50% of your personnel being Nigerians, and you've been here for more than 5 years. You pay taxes, and the leadership of that organization in Nigeria is also a Nigerian. So you can, and you have never received up to $5 million US from USAID. So these are some of what qualifies those organizations to directly come forward with their proposals, especially when we issue a call. But if we have not issued any call and you feel you have an idea that requires attention, we have opportunities for unsolicited proposals, which you also can submit. We look at it on its merit, and you will definitely get a response. It may be a yes, it may be, it may not really be a no, because we'll come back to you to ask you to do some amendments, or the worst that you can get is to keep it in view to ensure that it happens. If we don't work with you directly, we can introduce you to a partner who is doing a similar thing. They can give you some aspects of that work, so you can use it to showcase yourself and also strengthen your capacity, because we have challenges of capacity. In as much as we train people, we want people to work under established organizations. If you are local and you think you are good, you can help us to deliver on our mandate. We can also say, okay, work with UNICEF or work with PFD or work with VIPG for a time. They will be giving you guidance, looking at your books, helping you to maintain financial prudence. Then when they now can guarantee of your ability to take on higher tasks, we can work with you directly. So these are how we have been, we have a number of activities. This is, in a nutshell, how we've been contributing to reducing the numbers. And I don't want to go into giving you details on how much each of those contracts is worth. So thank you, Vicky. If there's any questions for me, let me know. Thank you.
Thank you so much for all. We always have so much information. So thank you so much for your presentation. Again, as you were speaking, I'm thinking, okay, here is this huge mountain that we're taking bites out of. I'm wondering if at the national level, do we know how much we are reducing this mountain year after year, so that we can sort of look at it and say that, okay, come 2030, we would have dealt with the problem the way it should have been dealt with. Do we have anywhere where we are keeping our data? You know, there's a national data repository where all the funders are putting their performance information in there based on how everybody that is involved in WASH is doing. 2030, we would have done this. Do you know?
Yeah, I think Jen would have been in a better position to answer this question if she's still around, or Engineer Benson.
Yes, she's still here.
But I know that there is the WASH norm is all about that. So I will leave it at that for her to give us more information. Thank you.
Yeah, I mean, I can tell you that the WASH norm doesn't distinguish, it just looks at access. So it doesn't say who provided. But in terms of a repository of donors and NGOs, I'm not sure that there is an official one, but you'd have to ask the ministry. But certainly I'm involved, and I know Joachim is too, in the Development Partners Group for WASH, which is a grouping of donors for WASH, and we meet quarterly, and that we do have a tally, a record, but it's obviously up to individual partners to update, like a spreadsheet of where everybody is working and what they're working on.
Okay, Engineer Benson, are you there?
Yes, Vicky, I'm here. Good morning. Let me thank you for bringing me in to discuss on this issue of national database. The WASH norm survey is basically an output-based survey. And I think the purpose is for us to monitor the progress we are making towards achieving the SDG targets at 6.1 and 6.2 specifically. It does not track input as such. So where the funds are coming or what development partners are doing is not the purpose of the WASH norm survey. The purpose is to see what is the results? What results are we getting? So how much of those that don't have access are we reducing, year in, year out? From the time it started up to now, we have been saying that so number of people have been taken off open defecation, or have gained access to water supply, or gain access to adequate sanitation, and then of course it tracks the how much each household is spending, to gain access or without access, what they are. So these are the kind of things that WASH norm does. And I think perhaps that is the question you are asking, that are we really tracking how we are making progress? I would say yes. The WASH norm survey is tracking that for us every year. The last one was just launched this year, which was for year 2020, I think, yes. No, so every year we do this survey at the national level, which is the Federal Minister of Water Resources, in conjunction with UNICEF and National Bureau of Statistics, conducts every year. Thank you.
Okay. Well, I know that's not all your talk, but I still have I have a suggestion, and that is that we set up a centralized database where probably, it can be managed by the ministry, but it, probably managed by the ministry and the development partners, so that we can begin to collate data based on investments in the sector, performance in all the different indicators in the sector in real time. As a project is ending, that information is put into that database so that we can see how we're doing. And that is one of the bases of an M&E learning framework, really, so that we can, from there, you can actually see what progress we're making in real time. So if I was a donor, if I'm a donor coming into Nigeria to invest in the WASH sector, I can just go and look at that database and say, okay, in the next 5 years, 50 billion is coming into the sector, and this is where it's going. So this is where there's a need, and this is where I can go and invest and have the most impact. What it looks like to me from the outside is that there's all this data, but it's in the hands of different groupings or different organizations. And because it doesn't all come together, when I'm looking at it, I'm thinking 150 million people in 7 years. If I divide 150 million by 7, I have to come up with a certain number of people connected. And in real life, if you go into the field and you really start doing an impact studies, you will see that we are not doing as well as we say we're doing. We need to be, from here on, we need to be getting numbers that are like around 22 million a year. That's new numbers, 22 million a year, in order for us to meet this SDG 6.1 and 6.2. So I don't think it's just to the ministry, but to the WASH community as a whole, to see that there's a need for us to really see how big the mountain is, who is tackling what from which side of the mountain. And so that we can all level this mountain is in our own interest, and it's to the benefit of our beneficiaries. So that said, now you can go on. Now nobody's asking you any more questions. Tell us how you think we should tackle this whole problem with the inequality as it exists now.
All right, thank you very much, Vicky, and good day again to everyone on the platform. I'm Engineer Benson Ajishigiri. As you all know me, I have worked for several years in the sector before I retired. So I'm very happy to be with the group this morning. And then the topic is meeting the SDG 6, dealing with inequality in access to WASH services in rural areas. First of all, I will say that inequality is not only prevalent in rural areas, the urban areas are also, taking about of inequalities of access to WASH services. We have to generalize, because even in the rural areas, I don't think it's as pronounced as what you have in the urban areas. So inequality on access to WASH services is a thing that must be pragmatically tackled, through deliberate policy of government, and in the planning of programs and projects, as well as in the execution and operation of such projects, and then in terms of also collaboration, here and there. So before I left the service, at the national level, a lot has been done along that line. The federal government has retuned the policy to ensure that there is improved access and accelerated access to work services, based on the principles of leaving no one behind. And then that gave rise to the planning that took place at that time, and then the program that evolved in terms of partnership for expanded water supply, sanitation, and hygiene, which was quite applauded by all the development partners, both within and outside the country. If we followed the implementation of that program, which is the Partnership for Expanded Water Supply, Sanitation, and Hygiene, it will bridge these big gaps of inequality as fast as possible. I would say that at the national level, there was a lot of seriousness on the implementation of PWASH. PWASH, as we all know, is targeted towards rural areas. That is Partnership for Expanded Water Supply, Sanitation, and Hygiene in the rural areas. It is meant to, pull different stakeholders together from both the government at the different levels, the local government, state government, federal government, development partners, the private sector, and the NGO, to have an umbrella through which we can be addressing the issue. Hello?
Paul, help us.
I've done that already.
Okay.
Go on, sir.
Okay,
All
thank
right.
you.
So that we can have an umbrella through which we'll be making contribution, to reduce the humongous gaps that we have, on work services in Nigeria. So we have that umbrella already created, and the federal government is very serious, at least from all that I've seen before I left service. They have a budget line. They have, the program strategic framework, and then targets the states at all times, and then they make project demand, responsive program. And before I left, I think quite up close to 18 state governments have keyed in. But an assessment that I've made since I left has shown that most state governments have not shown that kind of commensurate seriousness that the federal government has brought into it. So that there's need for the state government to make the state government to be more serious in the implementation of Partnership for Expanded Water Supply, Sanitation, and Hygiene, which is a program that will bridge, all these gaps that we have in the work services, especially in the rural areas. It has, different, aspects. There is the aspects that we expect the development partners to contribute to, just based on what you were saying, how the development partners can bring up funds, to bridge the gap in certain areas based on the statistics that will have come out of WashNum, from time to time. And then also there's room for the private sector, which have not been harnessed at all. We made attempts, to do that before I left the service, but it was not strengthened, because that needs to still be strengthened by the federal government, so that, because there's a lot of funds there in the private sector, and many of them, through their corporate social responsibilities, may want to support government or support communities in one way or the other, and all these have to be harnessed. And then, because whatever effort is coming from anywhere will help in reducing the gaps that we have, in the sector. There's also the room for NGOs, which to some extent has been tapped, but to the large extent have not been tapped. So I believe that where the problem lies mostly is at the subnational level, at the state government and the local government. Local government are not even responsive at all, because of the peculiar situation that they have. Majority of them do not even have funds to operate. They don't have personnel, and most of their funds have been hijacked by the state government And the state government most times pay lip services to issue of what services. So we must find a deliberate effort to see how we can motivate, state governors, especially because they are the one that needs to bring on board as much as possible, to play their role towards reducing, this inequality in access to work services in the rural areas. There's also the area that I mean in the design and the execution of projects. We need to take into cognizance, issues of bringing everyone on board, so that nobody is discriminated against. Must look at areas where the services are needed. Must look at the group that need the services, especially the physically challenged people who also must have access to work services. This also come into the part of the design that's made, in our projects and programs. Also, we have to look at our schools. If you look at the WASH norms survey data that has been presented, quite a number of schools do not even have, WASH infrastructure in the school. And where they are even existing, there is no room to have separation between girls and boys, and these are some of the issues that have come out of the WASH norm data and the survey that has been carried out. So we need to look at our schools. We need to look at our public areas where we have our markets, where we have motor parks, our health centers, and so many other public areas that we need to be looking into. These are areas that we have, inequalities that are so pronounced, that needs to be bridged as much as possible. But like I said, it is for collaboration and cooperation between governments at all levels, among governments at all levels, based on the existing policy and programs that have been designed that needs to be implemented. So the deliberate effort must be made to bring state government, to motivate state government, to collaborate in this partnership agreement that the federal government have, brought out for bringing the work services in Nigeria. Just like you said, if we are talking about SDG 6, because if you are saying that we have just 150 million people to cater for between now and 2030, we are still being modest. I must let you know that. The real SDG, the real SDG, we have far more than that. We have now achieved up to 10% as far as SDG 6.1 or SDG 6.2 is concerned in terms of its definition of access. So definitely, we are just still using the MDG definition. If you have to really base it on the SDG definition of access to work services, we are far below 10%. And if you take just 10% of our population of 220 million, we're just talking about 22 to 25 million Nigerians that can be classified to have access to SDG WASH services. So we have a lot of work to do. And it has to be by deliberate action, from federal government to state government to local government. And then I'm so quite happy about what is happening, on ending open defecation in Nigeria. And the minister has been so passionate. The Minister of Water Resources, Engineer Suleiman, has been so passionate about that. And then the Vice President is supporting so well. But how far is it going with the state government? That program has been launched now for close to 3 years, and I think at last count, just about barely 80 or 80 something local governments out of 774 local governments are open defecation free. So we need to up our games. We need to work more. We need to work harder. We need to, I think the best that the federal government needs to do will be to do more advocacy. We need to do more advocacy. We need to, put into this for state government to know. As a matter of fact, there should be a deliberate, conference on this that will be organized at the federal level to be hosted by the vice president, since it's already in this, ending open defecation issue, to bring all the state governors, because if this vice president going to be there. And it will be centered on this, not National Economic Council, where we just make a presentation and everybody will get a look. But if we have a deliberate conference, governance conference on WASH, and we discuss on how to tackle, then we give to them, what, the federal government have designed, all of their comments on how they can launch on those programs and ensure that at least they implement and coordinate in their states. We can further motivate them to say, with the best states, we attract more funding from development partners and things like that. So these are some of the areas that I think, but for funds to be coming in trickles, mostly from development partners, will not take us too far. We need to dedicate substantial part of our budget, money that are generated at the national, at the state level, at local government level, substantially to tackle the issue of WASH based on the current gaps, that we have to be able to achieve SDG in 2030. I think let me stop there for now. Thank you very much.
Thank you so much, sir. We have heard this thing from every angle. I know that we have some people from the various states here. I think I saw KB and I saw Kaduna. And so I would like to hear from one of the state level. What are you guys seeing at the state level? I have someone
raising his hand.
Someone's hand that is up. It says male integrated. You need to change your name because we don't see your name. We're going to be calling you male integrated. Okay. Go ahead, unmute yourself and speak. I'm not seeing that male integrated. Let me send him a message. But can we hear from someone at the state level? What's happening at the state level? Anyone?
Hello, can I talk, Madam Vicky?
Yes, your name is male integrated.
My name is Michael Ali.
Okay, your phone is showing male integrated.
Mail is my company's name. Good morning, everyone.
Okay.
Good morning.
Good morning.
Yeah, I'm so excited to be here. And let me wish my very good brother and boss happy birthday in arrears.
Yes.
A very good submission. We're talking about inequality, and I just want to go straight to the point. And I'll talk in two perspectives. I'll talk on the water supply aspect that has to do with the state water works. And I want to speak again about the private borehole drillers and how it affects populace. On the state water works, and we have in different states, I must say that the only issue that could affect inequality that has to do with water distribution and access by people has to do with their OPEX. That is the operational expenditure. At the moment, I know we have the Utility of the Future project by the World Bank, which I expect the Nigerian government to have fit this into perspective. That is transition from the normal method of, water transfer to the utility of the future using renewable energy. And that I'm going to pilot a project in Benue within the next 1 month. And I'm going to share with the Nigerian government. How do you transmit from the conventional method that will reduce your operational, activities? Because without that, if you are spending so much on your operational models, you'll find it difficult for you to have, water distributed to people. So that's a big issue when it comes to access. On the borehole aspect, I have data of how we, the borehole drillers, are faring. Right now, maybe in about 2 years ago, you can drill a borehole for 400,000. At the moment, if you are spending over 1 million, you are still undervalue your price because you will not make anything, because the assets issues that has to do with the exchange rate and the issue that has to do with diesel, purchase of diesel, has skyrocketed from 300 naira to about 850 naira at the moment, and everybody wants to make profit. So you see the people from the bottom of the pyramid will not have access to water, as far as even having an off-grid water supply to themselves. Again, when you look at the procurement process of the government, if you are given a project of 10 million last about 2 years ago, and the fact has to do with the current exchange rate and the issue that has to do with the diesel supply and the rest, and you are given the same project at the same 10 million, all you are just doing is looking at your procurement process and just picking it up, and you are giving it out to another contractor. Be rest assured that that project will not be sustainable. So these are the other the building blocks that we must check in for us to have a developed way to have water accessible to people. Because if you don't consider all of this, we'll just be coming from, just talking, and we'll not have an headway. So let's look critically onto the reasons why we don't have access, either from the rural or the whatever, and this has to be tackled, the exchange rate, and then the issue that has to do with diesel, that is the supply. So thank God yesterday, Nigeria launched the Energy Transition Pro Plan, led the Ministry of Water Resources look into that, what has to do, and that's going to help access, how we're transiting from what we're now to the next thing. And that will definitely help us even gain more from the carbon exchange. So there are quite a number of things that we are leaving behind, and I wish that we could go on and on.
We lost him.
Yes.
And
no,
say,
no.
it's not going to be
Oh, there he is.
last year that you continue to. Thank you very much.
Thank you so much, Mike. This is very, very extremely helpful. But we now have someone who is a private sector provider telling us what they are seeing in the field. Because up until now, we've been hearing mostly from the government and from donors, as well as the implementers, which is the state and local government areas. This is extremely helpful. Thank you, Mike. I hope that you'll be at the next WASH Academia. We've been trying to get the private sector in here, and it's been tough. So now that you are here, please tell others to come in. Thank you so much. We're very grateful. Okay, so can we hear from Alaji Danladi? Are you there?
Engineer Marcus is here now.
Okay. All right. Who wants to speak for the state? What are we seeing in the state?
Dr. Habiba, also from Kaduna State Water Board, is here too.
Okay, so why don't we take Kaduna State then? Dr. Habiba, can you hear me? Unmute your mic. Can she unmute her mic?
Yes.
Oh, there we go.
Oh, good morning, all.
Good morning.
Sorry, I'm not in a good position to talk because presently I'm at home and I'm with the kids. So they'll be disturbing you guys. I'm only listening.
Okay.
Okay.
Thank you.
All right. We can hear you. And we have someone here who is, we've been talking, when we're talking sanitation, we've been talking mostly about toilets and, and water supply. And, there are other areas of sanitation. We have Miss Doris Zakama here, and she says she works with a national NGO. And menstrual hygiene program is easy for us to do with women and girls. Like the reusable, washable sanitary pads to access and all. Doris, can you come up, please, and let's hear you.
Okay, hello. Hi, everyone.
Yeah.
Yes.
Hi.
Yeah, my name is Doris Zakama. I work with Center for Water and Environment Development. So let me be quick. And we are into wash sector. And, you know, when we go to communities, both urban and rural, we cannot be able to provide water for them. We cannot be able to provide sanitation for them because those involve huge capitals. But we also talk to them about it because of my training that we had with Newsan, not UNICEF training on CLTL. So I do trigger them on such things. But I found it easy to carry my reusable pad and go with it. That you see, even men are begging me to give to their girls. And I showed them how to use, but when we go back to get feedback, they always complain, Ma, it's easy to use this, but we water. So these are the things that we need the state water resources, the federal to come up with it. Because by using this reusable pad, you are reducing the waste of disposable pads. So these are the things that is easy for me in any program we do it. In fact, the next one that we are going to do is the one for Girls' Day for International Day. You understand? That even some teachers are even asking, can we sell for them? We say, we as an angel, we only buy to share. If they want to buy, this is the way they will buy. And I'm also training some women on how to sew this part. They have perfect their hands, but it's to get the material in China now that we are working on. Thank you.
Thank you so much, Doris. So
Yes,
this underscores what we have always said before, that in order for sanitation to work, the biggest part of sanitation of the entire wash system is water supply.
Yes,
so yeah, so this underscores that. Thank you so much.
Thank you, ma'am.
All right, who else is speaking for the states or implementing level?
Okay, let me chip in something before I leave.
Okay.
Vicky, yeah, you know, globally, USAID classified countries based on the need, such as the inequality and the inequity you are talking about here. So some countries are classified as high priority, and some are just classified as priority countries. So high priority countries, Nigeria was so classified as a high priority country based on these gaps, the need, the disparities we have in equality and access. So, and what it means is more money is given to higher priority countries, and other supports are given, and there are strategic plans that are developed. If you Google USAID and you see you look for strategic plans, you see that Nigeria was listed among the high priority countries. And this is not just done administratively. This is done by the US Congress to support countries to come up the ladder, improve access, so that people can have the water they need for prosperity and good health. So we program along this line. And you see, because of the nature of our country, the Federation, you see that the federal government is policy setting, institutional support and all those. And then where the action, the service provision is, the construction of infrastructure is mostly at the states. But you see that in the country where you have elements of good governance, which is tracked, is at the federal level, you can go to any level, any federal ministry, and you see people there, you see work going on. But in most states, that is not the case. People, you find things that don't really flow the way they should. So when we go to states where we have the bulk of these activities, because we program directly with the states, you find a lot of, they're only interested in mostly the political aspect of it. A typical utility will want you to come and work with them, and maybe the MD or the CEO of the water utility is happy to tell the governor, I attracted these people to the state, and maybe use it as a leverage to get the World Bank or get other donors to come. But to the extent of their adapting the best practices you are bringing up or trying to change the business as usual attitude has remained a challenge. And this kind of behavior keeps exacerbating the inequalities and the inequities in the system. So I will really appreciate that state counterparts who are here speak for themselves, because the kind of favor we see at the federal level, the kind of interest, the type of the capacity we see at the federal level, we don't see it. We don't see it as a state. So that's the challenge. So we want to really know what is actually the problem and how can that be arrested. If you see, okay, let me give you an example. We designed the e-wash activity, and we went to 6 states. But at the close of that activity, 1 state dropped, because at that point, when the implementation started, they started complaining that the requirements of the award of the project is not what they thought it was, because it required they open their books. It required they adopt principles of professionalization and commercialization. It requires a lot of things that will help to strengthen the system. So they were even honest to discontinue, but others managed to pretend. I'm sorry, I'm using that word, and think to exhaust that timeline. And unfortunately, nothing changed. I went to one of the states recently. We rehabilitated, USAID rehabilitated a water scheme in an urban community. So what they did was they locked it up. They locked the facility up. So can we visit? Yes, they happily took us there, and we had a session with the community. The community said these guys locked it up. They even asked us to buy materials to connect us. We bought and we have not seen them. And then the utility was saying, we promised you, because they accused the utility, you promised us 1,000 free connection. The first 1,000 people will be connected. And the requirements, we met the requirements, but nobody was coming forward. And then the utility was now saying, oh, we didn't really calculate the cost properly. We realized that we cannot be able to keep to that promise. And the best approach was to keep everybody in the dark. Nobody knew what was going on. So that kind of attitude, and I don't know the kind of message they give to their governor, or whether the governor is really not interested in following up to ask appropriate questions. So we begin to wonder what kind of people do we have running some of these things for us. So I will leave it at that, and maybe they can speak for themselves. Thank you.
Okay, thank you so much. Okay, over to you, the states. We need to hear you. I know there are people from Kaduna here, other than Dr. Habiba. There are other people from Kaduna here, and there's a Kitty in the room. So let's hear you.
Can I speak?
Yes, sir. Who is I? Marcus.
My name is Engineer Marcus, a retired director, Water Resources, Kaduna State.
Okay.
Yeah, for the states, Kaduna State actually has the political will, because if you look at Kaduna State has always been involved in developmental project on wash infrastructure, cooperating with like Islamic Development Bank, African Development Bank, World Bank, UNICEF, not to say the rest. But you see, if we're talking of rural areas, it's good to mention one of the problems presently that hinders taking all this infrastructure. For example, before I retired last year, I know we had issues of accessibility because as a result of this insecurity, we had projects in Brindongwari that could not implement because of insecurity. So I think we should also talk about insecurity as one of the major problem of achieving this SDGs 6.1 and 2.
6.2, yeah.
Yes. Thank you.
Thank you. Who has a comment on that? So what he's saying is that when the insecurity is not allowing states that are trying to implement to assess the areas where they would like to implement. That's what you said, right? Yes, sir. Okay. All right. So who wants to talk about that? We know that the insecurity is affecting everything in the country. And it's not just in WASH. It didn't occur to me that it was affecting our WASH programs. Can we hear from someone about that?
Hello?
Yes, Doris?
Yeah, yes, the insecurity is really affecting us, especially with the local NGO that we don't have a hazard allowance or security backup. For us to go to community on now, because we've been doing our own triggering little that we know from training we had Celsius with Newson, but we don't take risks now to go to communities and trigger them on hygiene or Celsius or menstrual hygiene or how to collect their water storage and all those things. Really, security is really affecting us. So we just stick within the community. I mean, the urban town, the urban area. And most of the urban area, these are the people that listen to television or radio and rest. The community, the real rural community people, local people, it's not all of them that have access to social media or can watch TV or radio all the time. Only few that have the radio because of even electricity is also a problem for them to even stay. But when they see us, local NGO coming to them, they listen to us and they learn and they change their life. So security is affecting us.
Yeah, hello. If I can quickly also react to the issue of insecurity and how we can adapt. Idoko, this is Bukola.
Okay, Buki, okay.
Thank you. Yeah, so my name is Bukola. I work with an international NGO and I lead MEL activities. That's the monitoring, evaluation, research, learning, adaptive management for WASH across Africa. Well, I think for me, we all know the issue of insecurity in Nigeria is becoming a major menace across all sectors. And that is the more reason we need to continue to adapt and know that we cannot continue to do business as usual. And that brings me to USAID approach of localization and locally led interventions. Looking at the issue of insecurity is telling us that it is high time we took the approach of localization and locally led interventions more seriously and ensure that as we are trying to support these communities, these rural areas, we also need to begin to support them to take actions on their own, even when we are not there. The issue of ownership, the issue of ensuring that capacities are well enshrined within the communities themselves. Of course, we know the federal government of Nigeria is doing everything possible to address issue of insecurity. But like I'm trying to establish, localization is the way to go. And across all thematic areas of this intervention, from project design to implementation to monitoring, let them be able to do all of these things in their own language, in the way they can do it. There are lots of resources we can tap into within these communities. But if they continue to see us as Messiah, that, oh, we have come, and once we turn our back, everything collapses, that is where the issue will continue to be. We need to hold their hands to be able to get things done themselves, so that even from afar, we can be able to provide that support when we are not able to make our presence physical. So for me, we need to look at the approach of project design now and put more resources into localizing these interventions, put more resources into ensuring locally led approaches, you understand, that will be able to ensure that we adapt quickly whenever we have these issues of maybe insecurity or pandemic like COVID, that also was a major issue around 2000 and 2001, where most interventions could not go to the different communities. So we need to begin to think outside the box and bring in our adaptive management cap and begin to engage more to retain capacities within these communities. That is just my quick addition to the issue of insecurity.
Hello.
This is good. Yes.
Good morning, everybody. Good afternoon, everybody, the convener and everybody on the platform. I am Engineer Mrs. Agbeyo, the retired GM from Ekiti State Water Corporation. Though we were not into rural sanitation, but from our own experience, the EU project that was done across the states in the rural areas, that is supposed to be built and transferred to the communities. And they were having the WCA and all the rest people involved. The community was actually involved.